IPM Program Head, WFSA, Ganga Hospital. He has trained over 30 fellowship students from 18 countries, which is quite amazing and impressive. So welcome, Dr. Bala, my dear friend, and I'll turn it over to you.
Good evening, everyone, and good morning to the viewers from the rest of the world, including India. And I consider it a great privilege to be a part of the Stanford series, lecture series. And I'm really looking forward for a session which will depict the anesthesia practice in India. And I'm truly grateful to Michelle, Anna Crawford, and the entire team running this GHE lecture series program. Pranams to everyone, the Indian way of greeting. I bring to you greetings from the city of Coimbatore, India, which is the hub of yoga. The world over, we do a lot of activities in yoga. And you see what you see here in this picture is Adi Yogi. It's depicted as the first yoga person in this world, and this is the largest human bust on earth. And this is a part of the city of Coimbatore. And for all the students who have joined in today, I wanted to quote a couple of phrases which has inspired me for decades. So the statement says that we may be born in a middle-class family, but we can scale such heights in this lifetime that we can cause an industrial revolution or professional revolution to whichever profession you belong to. You may be born to illiterate parents, but you can die as a scholar of world repute. You may have been considered a misfit during your childhood days, but you can become role models for the future generation. What you are and what you have been has no bearing on what you can be, and you will be what you choose to be. So this is such a profound statement, which has provoked me and inspired me every day. And I thought it's very pertinent to share with young minds such quotes, which possibly could be of help to them as they grow professionally. So if you want to accomplish that, we need to keep asking ourselves, my future comes from where my time goes. So where should my time go? For everything that you want to do, you need to have the time. In essence, we reach a point in life when time almost becomes our God. So let us respect time and use every second to propel ourselves holistically in our chosen career. Each one of us want to be extremely successful, but success is all about being in the process of joyfully creating a life that reflects your highest values, your deepest beliefs, and your greatest dreams. So I would just want you to dream very, very high. And I'm truly privileged to be a part of a program organized by one of the legendary institutions in the world today, the Stanford School of Medicine. I'm truly happy and delighted to know that you have inspired millions of lives across the world, and you're an epitome of education and research. And I was delighted to know that legacy of innovation started, path-breaking research started in Stanford. And I'm truly happy that the first adult heart transplant was done in your institution in the United States. That was done there. And this is something which is amazing. 8 Nobel Prize winners over the past 6 decades. Very, very inspiring. And I continue to see that the legendary work is going on with the last one, which I see in the website as the scientists in Stanford find genetic signature enabling early accurate sepsis diagnosis. All this goes on to tell that all those who are working in Stanford are really gifted and blessed to be a part of an institution which inspires you every day. And I'm truly happy to share my thoughts on anesthesia practices in India, the largest democracy that the world boasts today. I bring to you greetings from my institution. Thanks, Chitra, for that lovely introduction, and thanks for being in the same city as me where this Ganga hospital is situated. And I look forward to seeing you next time when you visit Coimbatore. So these are the founders. There's a 650-bedded tertiary care referral center, as was mentioned by Chitra. And we have over 350 doctors, anesthesiology, and apart from us, it is orthopedic surgery and plastic surgery. And I just wanted to tell you that how do we graduate? I did my medical school in the Coimbatore Medical College Hospital, which is approximately a 6-year program. After that, you need to take an All India entrance exam to qualify for your postgraduate studies in anesthesia. So I did a 2-year diploma in anesthesia in BJ Medical College, Pune. And after that, yet another entrance examination to join my MD anesthesia in the Postgraduate Institute of Medical Education and Research. So it has been 6 years plus 2 years plus 3 years. However, there are a few different practices that happens, which I will be enumerating. If you're a medical student in India and if you want to take anesthesia as a career, there are a couple of parts which I'm going to explain it shortly. But this has been the journey that I took in to qualify for being an anesthesiologist. I always consider it as a privilege, and I thank my parents-in-law, and my family for being so supportive and for allowing me to grow the way I have grown so far. To talk about India, I thought it's very crucial and important that I divide this lecture, presenting the country first, and making the anesthesiologist of India and the different kinds of institution, different kind of practices that we have to give you a broad perspective of where India is. So initially, I'm going to present about the country itself. And this is a floral decoration of a national flag. And India is modern, it's diverse, and it's a very peaceful country. And as you know, it's one of the most populous country in the world. So whenever the population is huge with a diverse geography, you're confronted with several issues, especially the healthcare. For such a huge population is always a challenge. And India, which is just 75 years young post-independence, also faced a similar challenge of catering healthcare services to such huge population. But I'm extremely happy in the course of this talk, I would explain that how we have emerged from a place where we hardly had any infrastructure, equipments, human resources to what we are today, and how we are facing the challenge head on. And it's very diverse culturally, extremely colorful and diverse. And this is a reason why most of you should make it a point to be in India at least once to experience the rich culture of this country. The one you see on top, a so colorfully decorated camel, that's the Thar Desert of Rajasthan. The temples down in South India has got the architecture that you see in the left corner. And what you see is here, the man dressed up is Kathakali. And the one you see, the colorful people throwing color sand on each one is called the Holi. These are festivals which culturally diverse, but they bond us phenomenally. And we are the place for 6 different religions, and each of us following a different religion go to different centers of praying, like what you see here. However, we are by heart one. So it's called the unity in diversity. This is a huge Hindu temple. And in India, I think peace has become a very important component of daily life. And this is the temple for peace, or called the Lotus Temple. And the young Indians, irrespective of the religion, want to live in harmony. And we have excellent flora. It's absolutely diverse flora. We have the beautiful elephants, and peacock is the national bird. And we have several interesting, diverse geography, beautiful meadows and greeneries and beaches and deserts. And we have such lovely flora. And forests across the world. And now it's a vast nation. And to be productive, we need to moving fast. And the government of India has taken several steps in introducing multiple airports and also the metro trains and the fast running trains to make sure that you don't lose much time when you travel. And we are blessed to have the Mount Everest, which is so beautiful, and the Ganges, a perennial river considered to be very sacred for most of the Indians following Hinduism. That's the beautiful marble and architecture, the Taj Mahal in Agra, and the diverse temples that you see. The modern India has come of its age, and all of you might be knowing that we put Chandrayaan on the moon, a mission that we accomplished, and thanks to our scientists in ISRO. And the modern cities of the country, the downtown looks very fabulous with a lot of skyscrapers. The modern young Indians are into a lot of research and scientific work, which is a path-breaking effort by the government. And the last 2 decades has seen a phenomenal change in the educational system of the country. And as I said, the Indian Space Research Organization is doing pioneering work. And that's our new parliament that's being built. And we use technology in every aspect of life. And there you see a drone carrying a first aid box. And this is the modern workspace that we have with a lot of new things which have come into the creating the infrastructure to be globally competitive. And the fastest growing large economy in this world is our nation. And we have 6% consistent growth every year. And from the 13th rank, we moved to the 5th rank economically in the last 2 decades. And we have large startup incubators, which is a great promise to the country. We have created the largest C-Link, which is a marvel. And there's a lovely convention center which has come up in Mumbai, which we are ready to hold any international congress, including the World Congress of Anaesthesia. It's called the world's largest biometric and in the whole world. And unified digital payments, we have made a great mark. You see, even a vendor can use it. So it's a pay and scan. And this is one of the biggest digital payment systems of the world. And we have the 2nd largest highway network of the world. And we are in the forefront of artificial intelligence and robotics. So I thought it was very, very crucial to present the perspective of a growing nation, which had nothing 75 years ago. So this is India's Amrit Kaal, crossing critical thresholds projected. There's a projected size of the Indian economy in US trillion. And I think we are in the right track of growth. And the best part is India's working age population by 2030 will be 1 billion plus. I think this is a big investment. And I think we have a large workforce, which is going to help us. And this is a boom because India's working age population to total population ratio will be the highest of any large economy. And India's dependency ratio by 2030 will be 30%. So which means 70% of the Indians can be part of any working space. And India has got young population with a median age of 28.4 years, which is again a big boon. And because of the progress that we have made in economy, per capita income, and the medical services, the country currently boasts the life expectancy close to 68. And now I think I would congratulate all of you for becoming the angels of God by being an anesthesiologist. Why do we call ourselves as angels? Because God created pain and created anesthesiologists to alleviate pain. God created life and created anesthesiologists to preserve life. So we have the dual job of preserving life in critically ill patients and also provide pain relief to them instantly when they have. And why don't we call ourselves as angels? And I also would like to feel all of you to feel very happy that if you introspect, I would consider anesthesiology as the mother of modern medicine Because like each one of you, an anesthesia resident, whether you're in Stanford or in any other part of the world, you go through every single aspect of human care. So I just introspected and I found that we are extremely unique and versatile. You read everything from the premature to a centenarian, and I don't think any other subspecialization in anesthesia would go through this as much as we do. We talk and read about several comorbidities. We have to be good in pharmacy. We have to know about drug interactions. We look after the critically ill patients. We take care of trauma resuscitation. And whenever there is an end organ damage and where we need a transplant, whether it's liver, cardiac, and kidney, so we are the ones to look after them. We are experts in invasive monitoring. We assess the internal milieu dynamically. We have become a perioperative physician, and majority of the anesthesiologists have now embarked on the journey to become an expert in echocardiography, EFAST, thromboelastography, ventilation, flow volume loop, near-infrared spectroscopy. Thanks to the advent of ultrasound, we have got into airway ultrasound, gastric ultrasound. We are the ones we use largest amount of fluid therapy in the world, total parenteral nutrition, blood component therapy, look after patients in intensive care unit and make them do chest physiotherapy, take care of DVT prophylaxis, look after acute pain services, monitor the antibiotics, and we are the ones in majority of the world looking after, in charge of the code blue when there is a critical incident inside the hospital. We are there, and we have now become masters in percutaneous tracheostomies and intercostal drainage, do bronchoscopies, and also we have extended our work to chronic pain therapy. Don't you consider us as the most iconic branch of medicine, where you have embarked on a journey to educate yourself with so much of knowledge and skill to look after the human body completely. And I don't think there is any other specialist who looks after every organ. And I'm very, very happy that each one of us have chosen to be an anesthesiologist. And in the process of knowing so many things, I think it is very important that we embark on the journey of becoming perioperative physicians so that your visibility inside the hospital grows multifold. And I wanted to share with you, this is an editorial that I wrote where I shared that 2 decades of our experience as perioperative physician in my institution, Ganga Hospital. So we have only 3 departments: anesthesia, plastic surgery, and orthopedic surgery. So the surgical side looks after admission of a surgical patient, the surgery, the mobilization protocol, drain removal, and the anesthesiologist look after all the rest, including the pain relief, the antibiotics, their electrolyte imbalance, their arrhythmia, their diabetic status. And there is an anesthesiologist posted in the ward all the time, and they're in continuous touch with a senior consultant about the day-to-day changes that is happening in the perioperative period. Point of care ultrasound has completely revolutionized our perioperative care, and we use extensively ultrasound for our diagnosis. So I think it's very simple to understand. If there is one leader who owns the responsibility of a particular patient, the outcome is excellent. And this is what we have realized. When there are too many cooks, it really spoils the broth. So many people ask me, does it stress you so much to do so much, which more than operating theater? The answer is, which I got from our legend, Ronald D. Miller. I asked him, do anesthesiologists get stressed because they do so much? He said, I don't think so. And I asked him, what is the formula to remain stress-free? And he said 2 words. He said, you should become extremely competent. The competent anesthesiologists do not feel the stress, and you should be very passionate about your profession. And I asked him, can you explain about competence? He said, if you wanted to start an intravenous access, if you do it in one go in a thin vein, then you don't get stressed. But first time you do, you counter it. Next time you do, you counter it. The third time, your heart rate is pumping. And this, you call it as stress. So he says you can avoid stress by being extremely competent. And I think it's very important for every young anesthesiologist to become as competent as possible, as skillful as possible, as updated as possible, as knowledgeable as possible to prevent stress. I think it is not the working hours, it is the competence and the passion with which you work. And I would like all of you to exceed your own expectations by becoming very skillful, knowledgeable, at the same time have certain personal attributes like tremendous integrity to your system, to your hospital, to your patient, and very, very honest. And be humble. The more you grow, the more you become better. I think we need to be very humble. I think these 4 pillars will make you exceed your own expectations. And then to become this, I think we need to be very happy inside. We should have tremendous amount of inner peace. And to do that, you need to know how to manage time and how to do balanced activities. And you need to create a lovely professional working atmosphere. And similarly, at the same time, have a happy home. Quality time with family is crucial. This is a formula which has been given by one thought leader of this country, and weekly planning and peak hours. So it says 1 hour of physical wellness, 1 hour for reading and contemplation, 1 hour with family emotional need, 1 hour for futuristic growth, and 1 hour for spiritual needs. I think if we get into some formula like this, we can become one of the most sorted after role model leader in the chosen profession. And I would wish that all those young minds who are listening to this talk can consider adopting this for their own growth. And in India, the whole healthcare sector is regulated by the National Medical Commission. So this has 33 members, which regulates medical education and medical professionals. And it replaced Medical Council of India on the 25th of September 2020. The commission grants recognition of medical qualifications, gives accreditation to medical schools, grants registration to medical practitioners, and monitors medical practice and assess the medical infrastructure in India. So they are the ones who supervise the entire country, and they have made a huge impact in the healthcare delivery in this country. So now to take you through a journey, if you're an anesthesiologist, what are all the possible career paths that you can take, and where do you actually get to do it? The government-run hospitals are the ones which started when India got independence. And it was divided into 3 important categories. In the major cities, we had a medical college hospital, which was both treating the patients and for educating young doctors. So you could do MD anesthesia after 6 years of training of undergraduate medical school. If you want to become an anesthesiologist, you got trained in this government-run medical college hospitals, which used to be the tertiary care hospital and the main source of healthcare in this country about 3 decades ago. Then the government opened district hospitals and village hospitals called the primary health centers, which were involved in the care of people living in remote locations. They were not highly acute, but they were dealing with the day-to-day problems and for obstetric work to make sure the cesarean sections are done, but not all surgeries are done in all small hospitals in this country. So there was a referral system, and they would go from the smaller hospital to the district hospital to the medical college hospital. So all the super specialized work was being done in the medical college government-run hospital. And it was pertinent that the government thought that the employee state insurance scheme was introduced, and hospitals were created across the country for those who are working in the government sector, irrespective of their profession. For every month, they get a small amount is deducted, and it is used for the state insurance, and the people can go and get treated there free of cost. Then the next big change happened with the advent of private medical college hospitals. There are private medical college hospitals on almost all the cities in the country today, and they also offer MD anesthesia. So the next jump in the education happened, it was just not the government run, but also the private medical college hospitals, which mimic the government hospital in all aspects, started giving postgraduate education in anesthesia. The next big jump happened in education when the government introduced what is called as the National Board of Education, which is headquartered in our national capital, Delhi. So this is called DNB Anesthesia. It's again a 3-year program, but here, because India needed large number of anesthesiologists to help the huge population, it was not enough to have enough educated, qualified anesthesiologists just by the numbers coming out from the government-run hospital and the private medical college hospital. So the private corporate hospitals, which became an entity in this country in the last 3 decades, and we have rapidly progressed in this private corporate hospitals, doing all the high-end surgeries that globally are known of. And I will take you through those journey as well. So now a new way of learning came in. And so this is called DNB anesthesia. So if you want to become an anesthesiologist after you finish your 6-year undergraduate program, you can either do MD anesthesia or you can do DNB anesthesia, which are equal, and it's a 3-year program. And now the other few gaps are being met by the non-governmental organization-run hospital, including mission hospitals, charity hospitals, tribal hospitals, which are funded as a corporate social responsibility activity of several industries, industrial houses in this country. So we are trying our best to make sure that every single individual, irrespective of where he lives, he gets at least the primary care and he gets the best care. So we still have challenges, but we are trying to address many of those issues. Just wanted to quote few examples. So this is one of the modern hospital which offers, it's a private corporate hospital, which is situated in Mumbai, the Gokilabein Hospital. I just wanted to show you and depict you how India is transforming in healthcare. And you see the infrastructure created by these private institutions. This is a typical room. This is the intensive care unit, and the post-operative care unit looks similar. And absolute excellent facilities to rehabilitation, and modern technology made a tremendous amount of progress in robotic surgeries and the cath labs. And so it's what you see here is the neonatal intensive care unit. And this is another very nice hospital, AIG hospital in Hyderabad. So which is a huge gastroenterology unit, and it's their wet lab, and that's their library. And this is a Fernandez Hospital. There's a lot of work in obstetrics. And so they have introduced modern ways of doing labor delivery and painless labor. And 65% of the cases here get labor epidural, and high-risk obstetrics come here. And the Apex institution created by the government India was All India Institute of Medical Sciences at New Delhi, which is the Apex medical institution in this country, run by the government, and trains innumerable doctors in all specialization. And this is my alma mater, Postgraduate Institute of Medical Education and Research, Chandigarh, which also does pioneering work. And this is for masses. Here, the treatment is free. The corporate hospitals, you need to pay, but here the treatment is free. But they try to match the corporate hospital in every bit in giving it. And in India, the army contributes phenomenally, not only for protecting the country, but also the research and referrals and good clinical work. This is the Army Research and Referral Hospital in New Delhi. And you see that they do pioneering work, and you see our Prime Minister visiting them. And all kinds of, including liver transplants, happen in these referral hospitals. So it's a high-end hospitals. And one of the institutions which has been established in this country long ago, which serves as one of the referral centers for patients is CMC Vellore, situated close to the city of Coimbatore. And I would want to just quote an example of how NGOs and mission hospitals come in. So this is a hospital situated near Baroda. It's called the Muni Seva Ashram in a place called Godrej, and it does pioneering work in onco-anesthesia and onco-surgeries for people who cannot afford treatment in private hospitals. So several such institutions have cropped up across the country to take care of millions of people who cannot afford the treatment of modern care. And the government is, every state government is trying its best to introduce all the facilities in the state government-run hospitals. So the central government runs few institutions and the state government runs few institutions. This is an example of one of the largest government hospital in the country, the Savai Man Singh Hospital at Jaipur, and which also is a tertiary care referral center, and the treatment cost is free for all the patients. And several such centers are present across. It's called the urban and the rural primary health centers, which are preventive but also look after the day-to-day work. So this is in a nutshell about the various kinds of infrastructure available and the various kind of education that is available. So all the anesthesiologists of India are amalgamated together under one banner, the Indian Society of Anesthesiologists. Incidentally, we also share the same year that we got independence. This was formed way back in 1947, and in 2022, the country celebrated the Platinum Jubilee, as well as the Indian Society of Anesthesiologists celebrated its Platinum Jubilee, and it does pioneering work in creating guidelines, and it wants to impose safe practice of anesthesia, conduct CMEs, the medical education across the country. But the last few decades have seen a prolific growth of sister societies or specialized societies which focus highly on individual areas like Academy of Regional Anesthesia of India, Indian Society of Study of Pain, Indian Association of Pediatric Anesthesia, Cardiac Anesthesia, Neuroanesthesia. Recently, we have the Association of TIVA, TCI, Society for Onco-Anesthesia and Perioperative Care, Association of Obstetric Anesthesia. So they do high-level, high-quality meeting, which imparts and enriches people who are specializing in this particular area. And they also are the torchbearers for enhancing the skill sets in their respective field by offering fellowships. So there are 1-year fellowship, 2-year fellowships, which are done by accredited institutions and hospitals by these bodies. And there is a separate curriculum. And this has become a path-breaking new conceptualization which has happened in this country. Once you finish your MD anesthesia, you can go to any of the institutions which offers fellowships through these bodies. And also, I wanted to tell you that many of the anesthesiologists go into the critical care, and the Indian Society of Critical Care Medicine is doing pioneering work in teaching people in critical care, and also emergency medicine is emerging fast in this country as a specialty. And there are a lot of anesthesiologists who are moving into the emergency medicine arena. So this is in a nutshell to give you how that a career path can be chosen by a young anesthesiologist after finishes MD and he chooses to take a particular path. And education is completely transformed in this country, apart from the table teaching. And what we have got is, I just want to quote an example. I would like all of you to Google and see. This is a beautiful platform to learn. This is called RAA Online Learning, which is headquartered in Chennai, in my state. And RAA Online is an e-learning website on important medical specialties, providing critical and timely reinforcement to practicing professionals, as well as students who have periodic need for additional support in academic as well as practical experience-based guidance on day-to-day clinics and cases. So this digital learning has become a new conceptualization, and any time that a student wants to learn on a particular topic, he will be able to see the expert delivering the talk, and everything is in an app, and you're carrying it. So the library is in your hand. This is the biggest advantage of the modern digitalization, and this particular RAA online, I found it very useful. It's a 360-degree Medinfopedia. And one of the other modes of education in this country has been live transmission. Most of the conferences that we conduct also does live transmission. So, for example, in regional anesthesia, when we do a conference, we do live surgical procedures where the live block is being given by the specialist inside the operating room, and it is transmitted to the auditorium. So for the people to see live how an expert works, how he negates the issues, and how he makes sure that the challenges are met with ease. So this is a new way of learning, and it's very crucial and critical in India that at this point of time, this is being done for every specialization. And for a country like us, we need, with such a population, we need drugs, all the anesthesia drugs. And I'm very happy to share that Neon Laboratories Limited was the one who started early. They permeated the nook and corner of the country, and they offer the pharmaceutical drugs to every single city, village, and the tribal area. This has made anesthesiologist life very easy because of availability of all the drugs and the critical care drugs. Now, this is supported by the multiple other indigenously make in India pharmaceutical companies which has emerged, and including the Verenia, Mamnel, Troika, and few more companies which are coming. And as anesthesiologists, we thought it's very important to partner with industry for education and research. And I'm very, very happy to share that we do a lot of activities in teaching, education, research. We wanted to grow more, but we have made a good beginning. And I thank all the companies for being a part of the process. And I would like to especially thank the BBRON for creating through Esculap Academy, Regional Anesthesia Excellence Centers, Helmia for Mentoring Academy, Arcomed for the TIVA TCI, Sanofi for all the educational initiatives needing web help, Ladle and CAE for simulation-based learning, Fujifilm Sonoside for making sure focus and safe practice of regional anesthesia. They help us in conducting workshops across the world. Now, there is an interesting factor that I wanted to share with you. Many of the surgical patients in this country, when they choose the time for surgery, they would take their horoscope and try to match their stars. And they will tell us that I would wanted the surgery on Wednesday, but not between 7:30 and 9. That's not a good time for me. So this I thought I should share with you because this is very, very unique. In India, many of them have the concept of having a horoscope, which is the planetary positions when they were born. So based on the time they are born, there is a horoscope. So like an Aadhaar card, like a unique ID card, many Indians also possess this. And this is very unique, and I thought I should share it with you. A quick note about my institution. I joined this institution in the way back in 1995, and I wanted to share that when we were just 4 operating theaters and about 140 beds then, now to 38 operating theaters with 650 beds with 125 surgeries a day. All this changed because of the philosophy of trauma care that we gave. Though it's a private institution, when a polytrauma comes in, the next second, we start the process of resuscitation, irrespective of knowing whether the patient will afford anything for the treatment in a private institution. The government hospital serves everything free of cost, but private institutions do charge the patients for the care they provide. But the philosophy of our hospital, in spite of being private, they said every life is important and every life has to be saved, immaterial of whether they have money or no money. So this is something which I wanted to share with you. And this is possibly the reason that we could save several lives which otherwise wouldn't have been. And probably this is why we are growing, and we are going to add 8 more operating rooms. The constructions is going on because of the extreme demand. Currently, we have about 140 orthopedic surgeons, 40 plastic surgeons, 100 anesthesiologists working round the clock. And we are a hospital which don't go by the time. There are 14 anesthesiologists inside the hospital, even in the night. to make sure that we give honorable block to every single patient who comes with an injury and make them pain-free immediately. Happens all the 365 days. So I would consider this as the biggest contribution what we have given to our patients who come to our hospital, making them pain-free when they come injured. 60% of our patient population is trauma-based, and it's very vital that they get the block. And to evolve the system, it was important that we need to have senior consultant present in site for decision-making, not only for giving honorable blocks on critically ill patient, but also trauma resuscitation. So when a major injury comes, the primary care resuscitation, everything is done by anesthesiologist, including EFAST. So we don't call a radiologist, and the decision, if there is a blunt trauma abdomen, the anesthesiologist does the scan, and if he finds that there is a splenic injury, a resuscitative laparotomy is done. So no time is lost in getting other consultants, and all this is available in-house. And I'm happy to share and thank our surgical colleagues for allowing us to be the perioperative physician, which I enumerated before. So the last 2 decades, we have been the perioperative physician, and it has paid rich dividends. In the best dividend, I would think, is immediate and quick care offered to the patient. And more importantly, you become more competent because you are challenged every day by a new complication, and you learn about it and you become better. So when you are challenged, you become better, and that's how I think we grow. And because of the large number of cases we do and the perioperative care, we decided to start fellowship programs in regional anesthesia. We train close to 80 anesthesiologists in regional anesthesia fellowship program. We have both university fellowships accredited to Academy of Regional Anesthesia of India and few hospital fellowship. In total, we train about 80 new fellows every year. And from 2014, through the World Federation of Society of Anesthesia, we do international fellowship. And as mentioned earlier, we have trained 30 fellows who undergo training for 6 months, and we make them absolutely competent to administer every single block. And most importantly, we ask them to go and be the mentor for several of the students in their respective countries. I thank the World Federation for giving us an opportunity to train these fellows. Through the Asian Oceanic Society of Regional Anesthesia and Pain Medicine, we started international fellowships in regional anesthesia and Ganga Hospital to train people in the Asian Oceanic region since last year. So we also conduct the annual Ganga Anesthesia Refresher course. It's a course which is different because 60% of the topic are in anesthesia and clinical work, and 40% is on holistic growth. And we have a lot of skill enhancing hands-on workshop. I think I'll just run through. So this is, you see the polytrauma resuscitation, the philosophy. I said you see the honorable block, see the comfort of the patient by just giving one block in spite of such grievous injury. These are our national fellowship programs. This is during the farewell of one of them. This is our international fellow students getting trained. The one you see in the left is Dr. Cabo from Sierra Leone, the second single qualified anesthesiologist of a country, and he has become competent to use ultrasound. And the one you see on the right is the Mokaya from Nigeria. And I'm very happy to say that Fidzai from Zimbabwe and Anthony Kamau, both of them have become mentors. And similarly, we have students in Rwanda, Dr. Nayanvi, and we have Dr. Dalia Rensil, who started the Philippine Society of Regional Anesthesia after getting trained in Ganga hospitals. I'm very, very happy to say that the students whom we trained went back and became the mentors for several of those who were not being able to take this program. So this is just a picture to show the recent conference that we held, and I'm happy to share that Dr. Brendan Carvalho from your university was with us to deliver the oration. And this is Dr. Carolina Liu in the recent Ganga Anesthesia Refresher course. But having said all this, we know our challenges. We have not reached the same kind of infrastructure in rural areas. There is a possibility of deficiency in human resources and round-the-clock availability of professionals in tribal and rural areas. the infrastructure, the equipment, availability of blood bank in remote areas, and professional help from specialists. Sorry. So I'm very happy that each gap has been identified, and we are trying to work on this. For example, we have developed a new app. So professional help for those who are practicing in remote areas can be given through the app, and we are going to launch it very soon. Someone is practicing in a very remote location in one corner of the country, suddenly has a perioperative complication. He just takes a picture of the screen and then he shares it. There is a group of experts, 50 experts we have recruited for 1 month. So an alert will go to them and they will immediately call this person, one of them at least, and virtually connect with them and try to help them out to come out of this clinical challenge. So also in India, there's another big sector called as private practice. So those who are not working in corporate sector in medical college hospital, India is known it's for multiple small hospitals, anywhere from 10 beds to 200 beds. So there are different sized hospitals which also have operating rooms. And there is a large percentage of Indian anesthesiologists who are involved in this private practice. So this is a big segment, and I salute the Indian anesthesiologists who are doing private practice, because they are the ones who help us to meet the demand of the number of surgeries in this country. And they also have followed what is called as a new concept called as group practice. Multiple private practicing anesthesiologists join together, form a group, and so they help each other. And if somebody wants to take a leave, the other person would cover. So it's kind of a corporate governance in private practice, and the solution has been a group practice. So a lot of CSR activities given by industrial houses, philanthropists, and social outreach by our own anesthesiologists who say that in a month, 4 days, I will allocate to go and work in tribal areas free of cost. So all this are helping us to make sure that we meet the challenge. But our hope is that we are a strong emerging economy, and I think there should not be a deficiency in infrastructure and the equipment and the human resources in every part of the country. And what is promising is we have got a huge young working force and an interested younger generation, because there is a huge competition. For example, for the 80 fellowship programs that we offer, we do an online exam and about 800 young minds apply for the position. So it shows that there is a big group of interested young generation anesthesiologists. We recently launched the Anesthesia Patient Safety Forum of India in a recent program in Ganga Anesthesia refresher course. We will take this forward. The Indian Society of Anesthesiologists is also coming up with a lot of mentoring programs, a lot of online educational activities to bridge the gap. And we also want to launch a simulation-based learning to decrease the perioperative complication across India. The Indian Society of Anesthesiologists will soon formulate a program so that everyone can get updated. And we have simulation centers now, almost 2 centers in every city of the country. And it's become mandatory that every teaching hospital has a simulation-based training center. So we are also into moving our coins towards data mining, audit, and based on this to create our own guidelines and research, which there was a huge gap. We have understood the gap, and we know that we have the power players in data mining. India has got such a rich amount of educated professionals in data, and the Indian Society of Anesthesiologists wanted to enter into an agreement with them to make sure we mine our data and an audit, and which will give us a clarity about the guidelines that we need to create for our own. And the e-learning platform have really helped us. So we always look upon to the father of our nation, Mahatma Gandhi, who said, "Be the change." And we want to change every single day for the better. And we tell all our anesthesiologists that if you want to be the best, the simplest thing is to treat every patient as your own kith and kin. And if you do that, you will offer the best of your services. And the happiest people don't have the best of everything. They just make the best of everything they have. And I think this is what probably each one of us have to look into. We need to be very happy with what we have and how to do and contribute the best with what we have, rather than talking about things that we do not have. And I'm sure that this is the path-breaking statement for each one of us. And I think each one have to contribute phenomenally in their chosen profession to the countrymen so that they can make their country proud, and more importantly, their parents proud for creating them as a professional and as a doctor. And I deem it a great privilege and pleasure to have shared my thoughts on the several facets and healthcare possibilities, the career of anesthesia in India. And I really look forward to making sure that we enter into some kind of understanding between a legendary institute in Stanford and also take your help in our vision to fill the gaps and to make the whole country a level playing ground as far as anesthesia services are concerned. And I look forward for a day to have more of you visit us and many of us visit you so that we enter into a long-term collaboration in making sure we offer the best to our patients. And it's a true privilege to have shared this 45 minutes with those who are attending this session. And I'm extremely thankful for the entire leadership of Stanford who are involved in making this a possibility. And thank you so much, Anna, Michelle, and the entire team who gave me this opportunity. Thank you so much, and I look forward to answering to your questions if there are any. Thank you.
Dr. Bala, at one of your first slides talked about humility, and I think you've mastered that, because we all know that you are incredibly prolific, and many of us on the education committee at the WFSA, we have a suspicion that there's actually a clone of you because you're so prolific and you accomplish so many things. And we also know that the Ganga Hospital would probably be largely a for-profit hospital and not as academic if you weren't there. So thank you for the amazing work that you do every single day, and sharing your inspiration and your experience and your wisdom with us. We do have a few questions in the chat that I'll pull up. I think the first one was from Michelle, and she was asking if there was a reason why the medical commission was replaced when you mentioned.
The Medical Council of India had a different kind of governing body, and in a country which is evolving, we need to make sure that there are no deficiencies, and we need to listen to the feedback that you get from professionals. So it was thought that the way it was constituted, there were gaps which would prevent our growth. And we wanted to be more encompassing and more holistic. And so there was a need. And based on the feedback from professionals from across the medical fraternity, they got into a different kind of governing body. And having seen it closely the last few months, we are extremely happy and delighted. They are more proactive. And I think the changes that will happen will be very solid and will help us in our growth.
Wonderful. One question that I had, and something I think a lot about is I feel like we have a global community and that we all have so much to learn from each other. And so I feel like within the Division of Global Health Equity within the Department of Anesthesia at Stanford, we're actively trying to create bridges and opportunities for students, for trainees, for faculty to connect with other places and other institutions all across the world, because I think we're all better together and we learn so much from each other. What types of partnerships do you think, whether at Ganga Hospital or you personally or through the work that you do, what types of partnerships do you think are the most effective at serving our patients?
I think one of the most important things is any person who gets trained, it's just not alone in becoming competent in providing a particular care. For example, an ultrasound guided upper limb block is just only one aspect of training, but which you can actually get it done by watching several videos in the Google. However, the physical teaching and how you establish the connect with your patient, how to treat a possible complication which happens suddenly, and patients with multiple comorbids coming for a similar procedure, what is the pathway that you choose and how you choose. So these things can be learned only if someone gets mentored in a particular specialty. So I think this is the area where I think we should focus in sharing the experiences, which are very different based on the culture and the environment. And this would give a broader perspective for the trainees to learn. And so one of the best things can be done is to have an exchange program. For example, we have currently students from UK in the orthopedic side who come get trained for knee replacement surgeries and all that. And when I ask them, they say, though knee replacement is the same, there are different concepts that I've observed, and this is going to be a big learning. So I think the learning is mutual, and this is something which we can embark on a journey of exchange programs.
Yeah, I couldn't agree more. And I think your one discussion about patients using the star alignment for deciding what day to have their surgery is a great cultural learning, because no matter where you go in the globe, you always meet people from all over the world. So I think that's certainly one thing that we can learn from each other is certainly different cultural things. I'm going to look through the chat really quickly and see if there's others. It says, what do you think is the optimal strategy to educate customers and administrators about anesthesia solutions?
The best thing is anesthesiologists should move out of the operating room and try to help the administration as much as they can. So I found it, like, for example, when we took over the mantle of perioperative physician, our visibility increased so much, and every administrator knew the anesthesiologist as much as they knew a surgeon. Number one. Number two, the anesthesiologist became a part of almost all the committees: the blood transfusion committee, the pharmacotherapy committee, the code blue committee, and hospital infection control committee, because we know so much which we should offer. So I think we need to become proactive and become a part of every single committee and give our inputs what we think is the best. And I think this visibility need to be created by every single anesthesiologist. So by doing in the process, in our hospital, what we have achieved and accomplished is, whether they know the surgeon or not, they know the anesthesiologist.
Yeah, I couldn't agree more. I think we struggle sometimes in the United States in particular. I think sometimes we struggle with anesthesia feeling undervalued. And I think about 5 years ago, we had the same framing where we tried to say we're perioperative physicians and we really are important in the entire continuum of care for patients. And somewhere in the last, 5 or 6 years, that's been less of an influence. But I wish you would come and speak to the American Society of Anesthesiologists and our Congress and our insurance companies so that you could explain to them the value of anesthesiologists.
Yeah, true. I agree. Because initially it's a big issue because you need to take more responsibility, which you have not done before. It looks easy life, but then you need to struggle to get a better life.
Yeah. Could not agree more. Well, Dr. Bala, we are at the time, and I'm sure I would personally like to speak to you for several hours. And I hope this is the very beginning of our communication and collaboration across, between you and Stanford University. We certainly would love to have you speak again, and we do admire your work. And thank you so much. I don't know if we can thank you enough for spending time with us. So really, really grateful to you. So thank you so much.
Thank you so much, Dr. Anna. And I think it's been a delight to be with you, to share our thoughts with you and to show what we do in our country. And thanks for giving this opportunity to you and to your entire team. And as you rightly said, it's at the beginning of a new chapter of more collaboration for the betterment of human community across the globe. Thank you so much. I truly appreciate. And I thank Dr. Chitra, who came out of the way, though not being an anesthesiologist, to be with us this morning to give an introduction. Thank you so much.
Here as well. Thank you so much.
Thank you.
Bye,
Bye-bye.
everybody.
Bye. Bye-bye.
Bye, Bala.
Thank you. Bye.
Thank you, Dr. Bala, again from my side. It was very inspirational. And as a not a clinician, but from industry, it's always amazing your humbleness and yet how much you contribute to the rest of the world. So thank you so much. And thank you, everybody, for letting me attend this thing.
Thank you.
Have you.
Thank you, Bala, sir.
Thanks.
By the way, Dr. Anand, will I see you in Singapore?
Yes, I was going to say the same thing. I look forward to meeting you. Yes, yeah. You know, I think the only people on our committee who I've actually met in person is obviously Faye, but also Rodrigo. Rodrigo came to Stanford from Mexico City, and he gave a grand rounds. So
Okay.
we invited him as well to come. So I'm trying to, and then Nazreen, she also gave a lecture for us. So it's been really, really great to be able to connect with people on the